Good morning. My name is Carly Minniti. I'm the educator for behavioral health. I also cover float PCTs and patient observers. So I'm going to talk to you today about accountability and conflict resolution. I'm just going to share my screen. So accountability and responsibility, let's talk about that for a few minutes. So when you're in charge, it might feel like, oh my God, I have so much responsibility. I'm responsible for so much, but what are you really accountable for? So knowing what accountability means. So accountability, so it cannot be shared. You're accountable to your team members. You want to know where your team members are at all times on the shift. You might be in charge of the assignment. So that's something you're accountable to. You want to make sure it's fair. You want to know if anybody's going for procedures, who has Foley catheters, who has central lines. But it's the responsibility of the team to perform those daily cares. Are there any one-to-ones on your unit? You want to make sure their staffing is adequate for the one-to-ones and that they're justified as well. So that's something that you're accountable to, but it's a responsibility of the nurse to check on that patient. So there's a lot that you are accountable to, but you have your team to help you. So there's responsibilities for everybody on that unit. So charge nurse, enforcing the Nurse Practice Act, leading the staff, managing systems and processes. So what does that mean? So when you're in charge, you're accountable for safe care for every patient on that unit. But how do you do that? You do that by being an advocate for appropriate staffing. You're creating a fair and reasonable assignment. You're using your critical thinking skills, clinical expertise. You're going to be organized. So some roles as a charge nurse. You want to engage your team. You're going to be a team player and a team builder. You want to make sure everybody is working together, creating and maintaining a positive work environment. I know that can be difficult at times. There's different personalities. There's different opinions. So you want to make sure that you as a charge nurse, you really want to make sure that you're trying to stay positive. I know things can get very difficult, very hectic, really quick, but you're going to use your clinical expertise and your knowledge. You were put in this role for a reason. You're going to teach and share your knowledge and expertise. You could take opinions from others. It's great. This is why we work as a team, but you want to serve as a role model. You're going to delegate patient care activities appropriately. And you want to empower your team. You want to let them know they're doing a good job. It's always good to hear that you're doing a good job today. Maybe you want to provide some feedback on what things they could do better, but it's always good to reinforce a positive attitude. So let's talk about conflict a little bit, different levels of conflict. We have interpersonal conflict, intergroup conflict. So these are just different examples. You have different roles. Conflict might not always be a bad thing. We can use conflict to resolve potential issues, to answer questions that we need answered. So it's all about the way you handle it as a charge nurse. Take opinions from other team members, use your resources, use the physicians, respiratory, everybody's expertise. You might not be an expert in every area, but you could use your resources to help you resolve these conflicts. Sometimes there's conflicts with nurses and physicians, or maybe nurses from different genders or nationalities might have different opinions. There's an example here, intergroup conflict. If there's an RT and respiratory and nursing, who will suction the patient? So these are things that maybe you want to work it out. So whoever feels most confident in doing it does the task. You just want to make sure that safe care is being done for each patient. So what's your style? Personal conflict management style. So there's different styles of conflict, and it's all about how you handle it, like I mentioned before. So there's different times when to use these different styles. We have accommodating style. So if you can't come to a resolution, when you're mistaken, or maybe your team member is more experienced, so you want to accommodate. Knowing when to use this. What if a patient would like another nurse? Is it appropriate? Sometimes this is called staff splitting. So you want to make sure it's appropriate if you're going to change that patient assignment. Competing style. We have the competing style. I mean, we could use this example with physicians. How many times have we felt like maybe we didn't think the physician gave the right order? They could have done more. So we want to go ahead and do something ourselves that we think will help the patients. We feel like, we're being challenged. Or when you feel like no positive change has occurred. The physician gave the orders, but nothing's happening. I think we should do this. When you feel pushback. Maybe what you could do if it's keeping the patient safe and it's appropriate, maybe it's the right decision to make at that time. We have compromising when you need an immediate solution that might be temporary. You might need to compromise. When there's no solution that both parties will be happy with, compromise, make it happy for both or make it equal for both so patient care isn't negatively affected. There's also the avoiding style. This can be appropriate to use in a situation where maybe you don't have to make that decision right now. Maybe it's something that's going to occur later in the shift. So you know what? Let's wait. Maybe something will come about of this. Maybe the situation will unfold or the conflict will resolve itself, because that happens at times where the conflict might no longer be an issue 4 hours from now. Maybe another patient gets discharged or there's another admission that might change the flow of things. And then you have also the collaborating style. So when several people will be impacted by the resolution, you might want to collaborate. Let's work together on a plan. Let's see if you take this admission and I'll take this discharge, and maybe I'll take one of your patients from you. Maybe you can make that decision as a charge nurse. So knowing what situations or scenarios to use in certain management styles are important. Also have to consider the personalities of the people you're working with and their workflow. Certain team members, certain nurses and PCTs might be more confident in certain situations. So just knowing your team can really help you make decisions. So the conflict resolution process. So when you're in a conflict, which I'm sure happens often, it happens. What are the steps you need to take? First of all, you want to remain calm. You want to gather all of the information. You want to listen. You really want to listen to your team. You want to ask the necessary questions, clarify anything. You don't want to assume anything, so that you could help make the right decision. You want to really hear your team members, hear how they're feeling about the situation, how they're affected. You could agree on a common problem, come to an agreement, and identify possible solutions, brainstorm, work together, explore options. What can we do here in this situation? How can we make this better? So you really want to listen and gather all the facts first, so then you could reach an agreement. Thanks, everyone.